Hi, my name is Dr. Rudra Mohan, and through the Oral Health channel today we're going to be talking about natal and neonatal teeth. Let's start. So this is a very special episode, although it's a rare occurrence. A lot of parents, the new parents, when they see their child come into this world, they find that there are teeth present in the child at birth which are known as natal teeth, or they see the presence of teeth in the child within the first 30 days and they are known as neonatal teeth. Although it is a rare occurrence, it is known to be found with a lot of genetic disorders. On top of that, it can cause problems to the child because of the fact that the newborn needs the mother's milk and nutrition, for which it needs to suckle and breastfeed, and it can cause interferences in breastfeeding. At the same time, it can cause injuries to the child, cause sores on the ventral surface of the tongue and other places such as the lips and everything. So the occurrence is although rare, but it can cause a lot of troubling things for the parents, especially the mothers, because the child might not latch on because of the pain caused during the suckling moment. It might also cause the damage to the mother's nipple because of the fact that the tooth may be sharp, and that's where parents get confused. Now, the causes of neonatal teeth and natal teeth are many. There is no actual known etiology as to what is causing the formation of these teeth. It could be any sort of febrile state, febrile illness, any sort of infection or malnourishment or hypovitaminosis. However, there have been some classifications in the form. Usually they are broadly classified as immature or mature. That means the mature tooth looks like an actual primary tooth, and the immature tooth has a very irregular shape and might be just brownish and opaque in color. Now, there has been a classification that has been proposed in 1997 where they talk about what the tooth looks like. Especially, it looks like a bump on the gum margin, or it looks like a sharp edge, which is the incisal margin, that the top of the tooth is visible through the gums. A tooth which is present, which is attached to the gums with some sort of support of the root, which is not very much seen on the radiograph, and finally a completely formed tooth which has no roots whatsoever. Now the question comes, how much of this is causing the problem to the child and the mother in interference with the breastfeeding? Extractions usually are delayed after 10 days of delivery because of the fact that the intestinal flora, the commensal flora of the child's gut is not yet established, and that's why you need to wait for 10 days. And also this decision has to be made after parental consent and a clinical common sense and diagnosis and a clinical knowledge as to if this tooth requires removal or not, because it can cause risk of hemorrhage in terms of extractions within the first 10 days of the baby being born. And that's why you need to make sure that you wait for the next 10 days and you supplement them with vitamin K supplementation so that there is a reduced risk of hemorrhage. In cases that the tooth is causing a lot of problem, it's very sharp, the edges are very sharp, you might just want to smoothen it out if possible. Also, you have to take an x-ray to find out if the tooth is actually a part of the natural dentition, or it is a supernumerary teeth. That means the tooth is not supposed to be present at all. So mainly that's what it matters about, because it can cause a lot of problems to the child. It can cause a lot of pain, it can cause sores, it can cause ulcers, and it might lead to the most important thing that a child needs to do is have to breastfeed. So it's very important as parents, if you get to see something like this in your child's mouth within the first 30 days of birth, go to the pediatric dentist and visit a pediatrician to understand what needs to be done. And it has to be done under proper care, because it's already it's just less than 30 days since the child has been brought into this world. So the infection fighting scope and the immunity and all those things have not been very well established. So it's always better that you get a consult from an expert. So this was today's episode. Please like, share, subscribe, and do press the bell icon button for important updates. If you want to get in touch with me, here are my social media handles. Kindly refrain from calling me directly, as I might be busy with patients. Just drop me a message on WhatsApp with your name, location, and the common oral health problem that's causing you discomfort, and we'll have a dialogue. And if you have any queries, doubts, and apprehensions and insights, please feel free to put them in the YouTube comment section. So that's it for today. Thank you.